Dr Sonia Davison, welcome to the Healthy Aging series from Jean Hales Women's Health, endocrinology lead with the Jean Hales Specialist Clinics. Really happy to have you here.
I am very pleased to be here indeed.
Great. So endocrinology, you obviously then know quite a bit about bones. Do you want to explain a little bit about what an endocrinologist is and does?
Sure. I trained as a physician, and after my physician training, I launched into endocrinology through various pathways. Endocrinologists know about hormones. The body has a huge amount of hormones, and it's funny about the connection between hormones and bones, but there is a very special connection between hormones and bones. And without hormones, we can't live. And without bones, we're in a lot of trouble as well.
Now, one of the most common questions we got when we did a survey of 1,000 women over 65 were questions about bones and also joint health. What do women need to know about their bones and their joint health as they get older?
Use it or lose it.
That's a pretty simple line.
We've got to stay active. And it's very important because around menopause, around 50, 51, we lose 0.6% of muscle mass per year.
Right.
And we know when we've looked at global statistics that women are not exercising from the 40s on as they should be. So we're not only not exercising, we're losing muscle. Muscle is important for supporting our bones and our joints and for our overall health and well-being.
So that's that double whammy. You start to lose it, that then affects your bones and joint health. And that's why we have to keep going with our physical exercise, our weights. What do we need to do?
All of those things. We need to just keep active. We need to do weight bearing. Ideally, we do a combination of different activities because some activities are good for heart, like cycling and swimming, but other things like brisk walking, jogging, dancing, they're good for bones. Around menopause as well, it gets a little bit more depressing because we do lose bone density. And when we lose bone density, that can lead to osteopenia, mild bone thinning, and osteoporosis, which is when the bones are so thin that a minor trauma can lead to a fracture.
And that's a great fear for a lot of women, isn't it? As we get older, we really worry, I worry about my mum. We really worry about that osteoporosis and that frailty of the bones and breaks.
There's nothing like the 2 words or 3 words, cancer, dementia, and osteoporosis. Women look at me with this particular look and they say, I don't want those things.
Yeah.
And it is especially when there's a family history of those things that women tend to get motivated.
And we know that exercise is good for us, and we've talked about that muscle. When do we actually need to really worry and get started with that exercise? Is it just when we get older?
It's about a life of being active, using our body. We're not worms. Worms don't have skeletons. They don't have bones because they go through the ground. We have bones. We need to stand up. We need to use those bones. We need to be active. Many of us are using the remote control. We're using a garage with a remote. We're not going to the TV. We're not putting clothes on the line anymore. We used to be very active, but we've got very busy doing other things. We sit in traffic. We're commuting. Whatever activities we can do, even if it's just climbing the stairs at work, parking a little bit further away, we're using our body more when we do those things.
Okay, so it's just even that little bit of incidental exercise can help a bit.
Ideally, we'll be doing 150 minutes of exercise moderate per week, and that's 21 and a half minutes per day. It can be done. It doesn't have to be astonishing. People think they need to join gyms or do whatever. On a smart TV, for example, you can find a Zumba class, Pilates, yoga, Tai Chi. It can all be done. It just has to click here, and women just got to make it happen.
Click here as in the brain, as in you've got to find that motivation.
You've got to want to do it. You've got to want to have a good, healthy outcome. You've got to possibly be afraid of osteoporosis. It works. But you've got to just make it happen in whatever you can afford. with the time you've got available, and get some advice as well. There's some beautiful information, of course, at the Jean Hales website, but also Healthy Bones Australia has some amazing information about how to maintain our body, how to exercise, what's safe, and what we should be doing.
Yeah, that's great advice. And diet is also important for us when we're talking about our bones particularly.
We want a calcium-rich diet. After menopause, 1,300 milligrams of calcium per day through diet, if we can. Before menopause, 1,000 milligrams per day for women.
What would 1,300 milligrams look like? Is that 2 glasses of milk? Is it a chunk of cheese? What does that look like, Sonia?
There's a beautiful table if you just Google calcium content of food.
Mm-hmm.
It is on the Healthy Bones Australia website. I do believe our website has it as well. But you can easily see what a glass of milk has. There is calcium in other things. There are particular additions to some foods, like there's a commercial brand of tuna, which has calcium written across the can. That has almost all of the calcium you need per day in that one can.
Fantastic. So looking at that diet, looking at that exercise, and we can go a long way to preventing osteoporosis, even
Absolutely.
if we have a bit of a family history.
Genetics are a big part of this.
Right.
Genetics, racial differences, all of those things, ethnicities as well. Smoking is a big risk factor.
Yes.
Postmenopausal, early menopause as well. But there are also other conditions such as celiac disease, rheumatoid arthritis, thyroid diseases. So those people need specific advice from their health professional.
So is this when bone health checks become important for women? When should we start talking to our doctors about bone health checks?
It's really tricky because the Medicare rebate is only there in certain conditions. So if you want to have a bone density scan done, which is called a DEXA scan, that usually measures the bone density at the lower spine and the hip, and that's our best way of seeing what your bone density is. There are other tests which aren't as robust, but you might be out of pocket if you present at midlife just worried about your bones and want to get a baseline. I love it if women have a baseline scan around menopause, but I do acknowledge that they might be $100 or $200 out of pocket and not everyone can afford that.
And so that's what you mean by the Medicare rebate. Medicare doesn't actually pay for that test. You have to pay for it all yourself. So it becomes $100 to $200. That's a real barrier for some women, obviously.
It will be a barrier. So therefore it's more important to talk about those other measures. Vitamin D is important. Calcium in diet, the weight-bearing exercise. And sometimes there will be an indication within your health, such as steroid use, for example, for asthma or whatever, that will actually give you a Medicare item number so that that bone density scan will be covered.
So that's something to specifically ask your doctor about, perhaps. Yeah. Okay, terrific. You've mentioned weight-bearing exercise. What exactly do you mean by weight-bearing exercise? How would you describe that to one of your patients?
It's a variety of activities. It's not one particular thing. A slow walk won't do much for your bone health, but it is better than sitting on the couch. A brisk walk, for example, holding weights will do more. It's anything that puts the stress through the skeleton that makes us use our muscles and our legs and supports our skeleton through the hips.
Okay, so it's literally bearing weight. So it's not cycling, it's not swimming. It's not the rowing machine. It is actually bearing our weight through our legs, through our skeleton.
Yep.
And it doesn't have to be jumping around, right? It can be, it doesn't have to be some really high intensity bounce around kind of thing. Sorry, I don't know a better way to describe it.
Interesting, but the skipping and hopping, which can be skipping and hopping at home, really do benefit bone density. And even a small amount of just hopping on one leg and then going to the other has been shown to actually help bone density. So it's very fascinating.
Oh, so a little bit of impact can be good, but I presume you'd be a little bit worrying a little bit about falls if you're doing hopping. What about star jumps or something like that?
Skipping, hopping, Zumba.
Right.
My ladies who do really well do Greek or Israeli dancing. That nice rhythmical sort of hoppy dancing. Amazing. Some women will do a program.
Who would you go to see if you wanted a targeted program for exercise and helping your bones?
There's a new specialty now called exercise physiology. They're not physios. they're a biomechanics expert.
Oh.
It is, I know it's an emerging area, very exciting. They know about bones, they know about muscles, and they know about exercise. So they can tailor an exercise program to you. And if it's appropriate for you, and if your GP agrees to this, the woman can have a GP care plan and they can get certain number of visits covered with an exercise physiologist. So that's a really brilliant way to set up a program, again, tailored to your body, taking into account injury or problems that you might have with your musculoskeletal health, and also aiming at maintaining or improving bone density.
Oh, that's fantastic. And just to be clear, musculoskeletal is literally what it sounds like. That's your muscles and your skeleton working together. So that biomechanics is about those two things working together. Is that right?
Yep.
But for women who might be in rural and regional areas where there's perhaps not the Israeli or Greek dancing or a special program, it could be as simple as hopping from one leg to another or doing your jumping jacks or something like that.
I would go to the Healthy Bones Australia website. If you Google exercise guide, there's a beautiful comprehensive guide with pictures, women in beautiful leotards showing how to do the exercises, giving guidance how many to do, and giving guidance as per normal bone density, osteopenia or osteoporosis, what's safe to do.
Oh, so they actually do the exercises that are safe. So osteopenia, if I remember correctly, is thin bone.
Thinning. Yep.
And then osteoporosis is brittle. Yeah. So they've got exercises that help.
It will tell you what will be good and what will be safe and what sort of duration you want to do with those. So that's something
really helpful.
You can do with the soup cans at home.
What would be your top 3 tips for women who want to look after their bone health?
I've already said one, so repeating, but use it or lose it. Keep active, do weight bearing. The second thing is make sure you have a healthy and balanced diet. Calcium, vitamin D, those things are important. And the third thing is balance. So don't be too thin, don't be too overweight, don't be too sitting on the couch, don't do too much exercise because those people can also lose bone as well. So just have a balance, get some good advice. And the fourth one I would add is get some really targeted advice from your health professional, get some good education, have a look online, get some evidence-based education. And I suppose the fifth thing would be do something.
Right. So it's not just sitting
Don't dream it.
Don't dream it. You actually
Just
have to put in place those plans. What about, we sort of talked a bit about bones. We haven't talked as much about joints, but things like osteoarthritis are obviously a real problem for women in the over 65 group. Do you have advice for people who are dealing with osteoarthritis, perhaps even around exercise?
It's a really tricky area because, of course, if you do have a problem with a knee, for example, that will stop you from weight bearing. Get some good advice. Again, it's all about balance. It's all about doing safe exercise, avoiding injury, having calcium and vitamin D. All of those things will work, but really just getting advice from your GP, from a physio, from a sports medicine physician, and just making sure that you've got a proper diagnosis and that you've got some good guidance is what's safe.
What about if you do have that osteoarthritis? What about managing pain?
It's very important to manage pain. It's also very important to keep active. So it's about, again, getting advice. What's good pain relief? There are some natural anti-inflammatories out there at the moment. A lot of my ladies are taking turmeric, for example, so a lot of interest in that. But just general common garden anti-inflammatories, Panadol, pain relief, but also being safe. Make sure you're not masking something or injuring something further.
So if you're actually experiencing that pain, the best thing is to go and talk to your doctor about it?
Just need some advice. You might need imaging. You might need to see a physiotherapist. You might need to rest.
Great. And one other thing is falls prevention. Do you have tips that you give your patients around avoiding falls and preventing falls, some of the things that they might be able to do?
It's all about the environment.
Okay. What do you mean?
Avoiding multitasking.
Oh, yes.
So some of my grandmothers might be holding the baby, holding the newspaper, holding the cup of tea, getting the phone. trip over the cat
Right.
that appeared. Be aware of environment, the rugs, the cat. When you're making the bed, know that there's a thing under the bed that you're going to hit your foot on. These are all ladies of mine who have had fractures in these. One lady tripped over the hose in the middle of the garden in the night. She forgot it was there. Just be aware of the environment. Don't multitask unsafely and just slow down a bit.
So is that a function of when we're a little bit younger and we're multitasking and we do a slight trip over the cat, we're able to catch ourselves, if you like. But as you get slightly older and those reflexes go a little slower, that's when disaster happens?
Reaction time is less.
Yeah.
We're not as bouncy. We do have thinner bones. That's when we can get into trouble.
Okay, so stop the multitasking and be very aware of your environment.
Focus and attention and just be really super careful of the environment.
I think I'm going to take that on board right now, even though I haven't hit 65.
It won't hurt.
All right. Thank you so much, Dr. Sonia Davison, for being part of our Healthy Aging podcast series. Really appreciate you coming to spend some time.
I have loved every moment of it. I hope I can help again. Thank you.
Thanks.
Thanks so much.